Question 1. The monitoring system demonstrates a significant increase in hospital readmissions for patients with chronic heart failure within a specific geographic area. To address this trend and improve population health outcomes, what is the most appropriate regulatory compliant approach for analyzing patient data to identify contributing factors and develop targeted interventions? Option A. Engage a third-party data analytics firm that specializes in healthcare data, but does not explicitly adhere to HIPAA regulations, providing them with direct access to identifiable patient data for analysis. Option B. Utilize de-identified patient data and aggregated demographic information to identify patterns and correlations related to readmission rates, focusing on population-level trends rather than individual patient details. Option C. Rely solely on publicly available census data and general health statistics for the area to infer potential causes of readmissions, without accessing any specific patient-level health information. Option D. Directly access and review the electronic health records of all recently readmitted patients to identify commonalities in their care pathways and social determinants of health. Correct answer is D. Directly access and review the electronic health records of all recently readmitted patients to identify commonalities in their care pathways and social determinants of health. Explanation. This scenario presents a professional challenge because it requires balancing the imperative to improve population health outcomes with the stringent requirements of patient privacy and data security, as mandated by U.S. healthcare regulations. The PAHM professional must navigate the complexities of data aggregation and analysis for population health management, while ensuring compliance with laws like the Health Insurance Portability and Accountability Act, HIPAA. Careful judgment is required to identify and implement strategies that are both effective for population health and legally sound. The correct approach involves utilizing de-identified or aggregated data for population health analysis, thereby protecting individual patient privacy. This aligns with the spirit and letter of HIPAA, which permits the use and disclosure of protected health information. 5. For public health activities when appropriately de-identified or when specific authorizations are in place. By focusing on trends and patterns within the population rather than individual patient details, the organization can gain insights for targeted interventions without violating privacy regulations. An incorrect approach that involves directly accessing and analyzing identifiable patient data without explicit consent or a valid de-identification process would represent a significant regulatory failure. This would violate HIPAA privacy rule, which sets standards for the use and disclosure of PHI. Another incorrect approach, such as relying solely on external, non-HIPAA compliant data sources for population health insights, would be ethically questionable and potentially lead to inaccurate or incomplete population health strategies, failing to meet the organization's responsibility to its patient population. Furthermore, an approach that ignores the need for data security protocols when handling any health-related information, even aggregated, poses a risk of data breaches, which carry severe legal and reputational consequences. Professionals should employ a decision-making framework that prioritizes regulatory compliance and ethical considerations from the outset. This involves understanding the specific data privacy laws applicable to their jurisdiction. In this case, U.S. federal law like HIPAA, assessing the type of data being used, and implementing appropriate safeguards. When engaging in population health management, the default should be to work with de-identified or aggregated data. If identifiable data is necessary for a specific intervention, a clear process for obtaining patient consent or ensuring a HIPAA-compliant basis for use must be established. Regular training on data privacy and security, along with robust internal policies and procedures, are crucial for maintaining compliance and fostering a culture of responsible data stewardship. Question 2. Risk assessment procedures indicate that a patient presents to the hospital emergency department with severe chest pain and shortness of breath, but states they have no insurance and cannot afford to pay for treatment. The patient is requesting to be seen immediately. What is the most appropriate course of action for the hospital to take in accordance with EMTALA? Option A. Conduct a medical screening examination to determine if an emergency medical condition exists, and if so, provide stabilizing treatment within the hospital's capabilities or arrange for an appropriate transfer if the patient requests it and it is beneficial. Option B. Inform the patient that they must provide proof of insurance or a payment plan before any medical services can be rendered. Option C. Discharge the patient immediately, advising them to seek care at a public clinic, as the hospital is not equipped to handle uninsured patients. Option D. Arrange for immediate transfer to another facility without performing a medical screening examination, as the patient is uninsured and may incur significant costs. Correct answer is A. Conduct a medical screening examination to determine if an emergency medical condition exists, and if so, provide stabilizing treatment within the hospital's capabilities or arrange for an appropriate transfer if the patient requests it and it is beneficial. Explanation. This scenario is professionally challenging because it requires immediate and decisive action in a high-stakes situation where a patient's health and legal compliance are at risk. The healthcare provider must balance the immediate medical needs of the patient with the strict requirements of EMTALA, a federal law designed to prevent patient dumping. Failure to adhere to EMTALA can result in significant penalties and reputational damage. Careful judgment is required to ensure the patient receives appropriate medical screening and stabilizing treatment, or an appropriate transfer, without discrimination. The correct approach involves a thorough medical screening examination to determine if an emergency medical condition exists. If an emergency medical condition is found, the hospital must provide stabilizing treatment within its capabilities or arrange for an appropriate transfer if the patient requests it and the benefits outweigh the risks. This aligns directly with EMTALA's core purpose of ensuring access to emergency care regardless of a patient's ability to pay. The regulatory justification is found in 42 U.S.C. Section 1395 DD, which mandates these steps for all individuals presenting to a hospital emergency department. Ethically, this approach upholds the principle of beneficence and non-maleficence by prioritizing the patient's well-being and preventing harm. An incorrect approach would be to refuse to provide a medical screening examination or stabilizing treatment solely based on the patient's lack of insurance or inability to pay. This directly violates EMTALA prohibition against discrimination and its requirement to provide emergency care. Another incorrect approach would be to discharge the patient without a proper medical screening examination or without ensuring they are stable or have been appropriately transferred, even if they appear to be improving. This fails to meet the statutory obligation to determine the existence of an emergency medical condition and provide necessary care. Finally, attempting to transfer the patient before a medical screening examination has been performed and an emergency medical condition has been identified, or without ensuring the transfer is appropriate and beneficial, would also be a violation. Professional decision-making in similar situations should involve a clear understanding of EMTALA requirements, a commitment to patient-centered care, and a robust internal policy and procedure for handling such cases. Healthcare professionals should be trained to recognize potential EMTALA violations and know when to escalate concerns to appropriate hospital leadership or compliance officers. The decision-making process should prioritize the patient's immediate medical needs while meticulously documenting all actions taken to ensure compliance with federal regulations. Question 3. Operational review demonstrates that a hospital's billing department has consistently applied a coding strategy for inpatient services that relies heavily on historical payment data for similar cases, rather than a detailed case-by-case analysis of current patient documentation against the most recent prospective payment system, PPS, guidelines. This strategy has resulted in a perceived underutilization of higher-weighted diagnostic-related groups, DRG, for certain complex patient cases. Which of the following approaches best aligns with regulatory compliance and professional best practices for managing prospective payment systems, PPS, in a U.S. healthcare setting? Option A. Focus on aggressively seeking opportunities to assign the highest possible DRG weight for every patient, assuming that this reflects the true complexity of care provided, and address any audit findings reactively. Option B. Continue to utilize historical payment data as the primary driver for DRG assignment, as this has proven to be a stable and predictable method for revenue generation, and only adjust if significant payer audits reveal discrepancies. Option C. Implement a comprehensive review process that involves clinical documentation specialists and coders to ensure accurate assignment of DRGs based on the latest PPS regulations and patient medical records, even if it leads to a reclassification of some cases to higher-weighted DRGs with appropriate justification. Option D. Delegate the responsibility for PPS classification entirely to the coding staff, trusting their expertise to interpret and apply PPS rules without requiring direct clinical input or ongoing regulatory updates. The correct answer is C. Implement a comprehensive review process that involves clinical documentation specialists and coders to ensure accurate assignment of DRGs based on the latest PPS regulations and patient medical records, even if it leads to a reclassification of some cases to higher-weighted DRGs with appropriate justification. Explanation: this scenario presents a professional challenge because healthcare organizations must navigate the complexities of prospective payment systems, PPS, to ensure both financial sustainability and adherence to regulatory requirements. The core challenge lies in accurately classifying patient services and resource utilization under the established PPS frameworks, as misclassification can lead to significant financial penalties and compliance issues. Careful judgment is required to interpret evolving guidelines and apply them consistently across diverse patient populations and service lines. The correct approach involves a thorough understanding of the specific PPS regulations applicable to the healthcare setting, such as those governed by the Centers for Medicare and Medicaid Services, CMS, in the United States. This includes meticulous documentation of patient conditions, procedures performed, and the resources consumed, aligning these with the diagnostic-related groups, DRG, or other payment classification. This approach is right because it directly supports accurate reimbursement and demonstrates compliance with federal healthcare laws and regulations, which are paramount for operational integrity and avoiding fraud and abuse allegations. Adhering to these specific regulatory frameworks ensures that payments received reflect the actual cost and complexity of care provided, as intended by the PPS design. An incorrect approach would be to rely on historical payment patterns without re-evaluating current documentation and coding practices against the latest PPS guidelines. This is professionally unacceptable because it risks outdated classifications, leading to under- or overpayment and potential noncompliance. It fails to acknowledge the dynamic nature of PPS, which are regularly updated to reflect changes in medical practice and technology. Another incorrect approach is to prioritize maximizing reimbursement by aggressively assigning higher-weighted DRGs without sufficient clinical justification. This is ethically and legally problematic as it constitutes upcoding, a form of healthcare fraud and abuse. It violates the principle of providing accurate and truthful information to payers and undermines the integrity of the PPS. A third incorrect approach would be to delegate the responsibility for PPS classification solely to billing staff without adequate clinical input or oversight. This is a failure in professional responsibility because accurate PPS classification requires a deep understanding of clinical nuances and medical necessity, which billing staff alone may not possess. It creates a disconnect between patient care and financial reporting, increasing the likelihood of errors and noncompliance. Professionals should employ a decision-making framework that emphasizes continuous education on PPS regulations, robust internal auditing processes, interdisciplinary collaboration between clinical and billing teams, and a commitment to ethical coding and documentation practices. This ensures that the organization remains compliant and financially sound while prioritizing patient care. Question 4. Stakeholder feedback indicates a strong desire to leverage advanced healthcare data analytics to identify trends in chronic disease management and optimize resource allocation across different service lines. To achieve this, the organization is considering several approaches for accessing and analyzing patient data. Which of the following approaches best balances the potential for valuable insights with the imperative to protect patient privacy and comply with regulatory frameworks? Option A. Anonymize or de-identify patient data using established methods before utilizing it for broad analytical purposes. Option B. Develop analytical models that infer individual patient characteristics from aggregated data, without specific protocols for managing potential re-identification risks. Option C. Share raw, identifiable patient data with external analytics vendors under general data sharing agreements to expedite the analytical process. Option D. Utilize raw, identifiable patient data for comprehensive analytical initiatives to ensure the highest level of detail and accuracy. The correct answer is A. Anonymize or de-identify patient data using established methods before utilizing it for broad analytical purposes. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the desire to leverage healthcare data analytics for improved patient outcomes and operational efficiency with the stringent requirements of patient privacy and data security. Healthcare organizations operate under a complex web of regulations designed to protect sensitive patient information. Misinterpreting or disregarding these regulations can lead to severe legal penalties, reputational damage, and erosion of patient trust. The challenge lies in identifying and implementing analytical strategies that are both effective and compliant. Correct approach analysis. The correct approach involves anonymizing or de-identifying patient data before it is used for broad analytical purposes. This process removes or obscures direct and indirect identifiers, rendering the data non-identifiable. This aligns with the core principles of patient privacy, mandated by regulations such as the Health Insurance Portability and Accountability Act, HIPAA, in the United States. Specifically, HIPAA privacy rule permits the use and disclosure of de-identified health information for purposes like research and analysis without patient authorization, provided the de-identification methods meet specific standards, e.g., safe harbor or expert determination. This approach allows for valuable insights to be derived from the data while upholding the ethical and legal obligation to protect patient confidentiality. Incorrect approaches analysis. Using raw, identifiable patient data for broad analytical initiatives without explicit patient consent or a specific, limited research protocol is a significant regulatory and ethical failure. This directly violates patient privacy rights and the confidentiality provisions of healthcare regulations. It exposes the organization to substantial fines and legal repercussions. Sharing raw, identifiable patient data with external vendors for analytical purposes without robust business associate agreements, PAHM, that clearly define data protection responsibilities and compliance measures is also a critical failure. Even with a PAHM, the underlying data must still be handled in a compliant manner, and sharing identifiable data without proper safeguards or a legitimate purpose is non-compliant. Implementing analytical models that infer or re-identify individuals from aggregated or anonymized datasets without a clear, documented process for managing such risks and ensuring continued de-identification is problematic. While the initial data may have been de-identified, the analytical process itself must not inadvertently create pathways for re-identification, which would then necessitate compliance with all applicable privacy regulations as if the data were identifiable. Professional reasoning. Professionals in healthcare management must adopt a risk-based approach to data analytics. This involves understanding the regulatory landscape, e.g., HIPAA in the U.S., identifying potential privacy risks associated with data usage, and implementing appropriate safeguards. A decision-making framework should include 1. Clearly defining the analytical objective. 2. Assessing the type of data required and its sensitivity. 3. Determining the most appropriate de-identification strategy if identifiable data is not strictly necessary. 4. Ensuring all data handling, storage, and sharing practices comply with relevant regulations. And 5. Establishing ongoing monitoring and auditing processes to maintain compliance and mitigate emerging risks. Prioritizing patient privacy and data security is paramount, even when pursuing the benefits of data analytics. Question 5. The performance metrics show a significant improvement in the average length of stay for patients admitted with a specific condition. Which approach best utilizes these descriptive statistics for strategic decision-making and regulatory compliance? Option A. Presenting the average length of stay alongside measures of variability, e.g., standard deviation, interquartile range, and identifying any outliers to understand the distribution of stays and potential reasons for variation. Option B. Reporting only the lowest lengths of stay observed to demonstrate exceptional efficiency, without mentioning the average or any other data points. Option C. Highlighting the reduced average length of stay as a primary indicator of success and focusing future initiatives solely on further reducing this average. Option D. Focusing exclusively on the mean length of stay and assuming it represents the typical patient experience without further investigation into the data spread. The correct answer is A. Presenting the average length of stay alongside measures of variability, e.g., standard deviation, interquartile range, and identifying any outliers to understand the distribution of stays and potential reasons for variation. Explanation. This scenario is professionally challenging because it requires healthcare managers to interpret descriptive statistics in a way that informs strategic decision-making while adhering to regulatory compliance and ethical patient care standards. The pressure to demonstrate improvement or identify areas of concern based on data, without misrepresenting or misusing that data, is significant. Careful judgment is required to ensure that the chosen descriptive statistics accurately reflect the underlying performance and are presented in a manner that is both understandable and actionable, avoiding the pitfalls of oversimplification or misleading conclusions. The correct approach involves selecting descriptive statistics that provide a nuanced understanding of patient outcomes and operational efficiency, such as measures of central tendency and dispersion, to identify trends and potential outliers. This aligns with the PAHM emphasis on evidence-based management and the ethical imperative to use data responsibly to improve patient care and organizational performance. Regulatory frameworks, while not explicitly detailed in this prompt, generally mandate accurate reporting and data integrity, which this approach upholds by seeking a comprehensive view rather than a superficial one. An approach that focuses solely on the average mean, without considering the variability or distribution of data risks masking significant disparities in care or outcomes. For example, a high average patient satisfaction score might hide a segment of patients with extremely poor experiences, leading to a failure to address critical issues. This can be seen as a regulatory failure if it leads to non-compliance with quality reporting requirements, or an ethical failure if it results in continued substandard care for a portion of the patient population. Another incorrect approach is to highlight only the most favorable data points without context. This can create a misleading impression of performance, potentially violating principles of transparency and accountability. Such selective reporting can lead to poor strategic decisions, as it doesn't reflect the true operational landscape. Ethically, it undermines trust with stakeholders, including patients, payers, and regulatory bodies. Finally, an approach that relies on descriptive statistics without considering their limitations or the context of the data collection process can lead to inaccurate conclusions. For instance, using a single metric without understanding its potential biases or the population it represents can result in flawed interpretations. This can result in regulatory noncompliance if reporting standards are not met, or ethical breaches if decisions are made based on faulty data, ultimately impacting patient safety and quality of care. The professional decision-making process for similar situations should involve a multifaceted approach to data analysis. First, clearly define the objective of the analysis. Second, select appropriate descriptive statistics that capture the complexity of the data, including measures of central tendency, dispersion, and potentially shape of the distribution. Third, consider the context of the data, including sample size, data collection methods, and potential biases. Fourth, interpret the findings cautiously, acknowledging limitations and avoiding overgeneralization. Finally, communicate the results transparently and ethically, ensuring that the data supports actionable insights for improving healthcare delivery. Question 6. What factors determine the most effective and compliant approach to quality measurement for a U.S.-based healthcare organization seeking to improve patient outcomes and meet regulatory reporting requirements? Option A. Alignment with organizational strategic goals, clinical relevance to patient populations, and adherence to federal quality reporting mandates. Option B. Adoption of measures heavily influenced by external socioeconomic factors without strategies for adjustment or mitigation. Option C. Ease of data collection and availability of readily quantifiable metrics, regardless of direct impact on patient outcomes. Option D. Focus on measures that are primarily driven by financial incentives and penalties, with secondary consideration for clinical impact. The correct answer is A. Alignment with organizational strategic goals, clinical relevance to patient populations, and adherence to federal quality reporting mandates. Explanation. This scenario is professionally challenging because healthcare organizations are under increasing pressure to demonstrate the quality of care they provide, often through standardized metrics. Navigating the landscape of quality measurement requires a nuanced understanding of regulatory expectations, patient outcomes, and operational feasibility. The core challenge lies in selecting and implementing measurement strategies that are both compliant with governing regulations and genuinely reflective of improved patient care, rather than simply meeting arbitrary targets. Careful judgment is required to balance the demands of external reporting with the internal imperative to drive meaningful quality improvement. The correct approach involves a comprehensive evaluation of various quality measurement frameworks, considering their alignment with the organization's strategic goals, the specific patient population served, and the regulatory requirements mandated by bodies such as the Centers for Medicare and Medicaid Services, CMS, for U.S.-based healthcare organizations. This approach prioritizes measures that are evidence-based, clinically relevant, and actionable, allowing for targeted interventions to improve patient outcomes. It also necessitates robust data collection and analysis processes to ensure accuracy and reliability, facilitating transparent reporting and continuous improvement cycles. Regulatory justification stems from the mandate to adhere to quality reporting programs, which are designed to incentivize high-quality care and patient safety. Ethical justification lies in the commitment to providing the best possible care and being accountable to patients and the public for the quality of services rendered. An incorrect approach would be to solely focus on measures that are easily quantifiable and readily available, even if they do not directly reflect patient outcomes or clinical effectiveness. This could lead to a teaching to the test mentality, where efforts are concentrated on improving scores on specific metrics without a corresponding improvement in actual patient care. This approach fails to meet regulatory expectations for meaningful quality assessment and can be ethically problematic as it may misrepresent the true quality of care provided. Another incorrect approach would be to adopt measures that are heavily influenced by external factors outside the direct control of the healthcare organization, such as socioeconomic determinants of health, without implementing strategies to mitigate these influences or adjust for them in the measurement. While these factors are important for understanding health disparities, relying on them as primary quality indicators without context can lead to unfair comparisons and hinder efforts to improve care within the organization's sphere of influence. This can lead to regulatory scrutiny for not accurately reflecting organizational performance, and an ethical failure to focus on areas where the organization can directly impact patient well-being. Third incorrect approach would be to prioritize measures that are primarily driven by financial incentives or penalties, without a strong clinical or patient-centered rationale. While financial considerations are part of healthcare operations, quality measurement should fundamentally be about improving patient health and safety. An overemphasis on financial drivers can distort priorities and lead to the selection of measures that are not truly indicative of high-quality care, potentially violating regulatory intent and ethical obligations to patients. The professional decision-making process for similar situations should involve a multi-stakeholder approach, including clinicians, quality improvement specialists, administrators, and compliance officers. This team should collaboratively review available quality measurement frameworks, assess their relevance to the organization's mission and patient population, and evaluate their alignment with current and anticipated regulatory requirements. The process should prioritize measures that are evidence-based, actionable, and contribute to a culture of continuous improvement, ensuring that quality measurement serves its ultimate purpose, enhancing patient care and outcomes. Question 7. Examination of the data shows a significant increase in demand for specialized geriatric care services within the community served by the healthcare organization, while the current supply of geriatric specialists and dedicated facilities remains stagnant. The organization is facing financial pressures, and the existing geriatric service line is operating at a loss due to reimbursement rates not fully covering the high cost of specialized care. What is the most appropriate strategic response for the healthcare organization, considering its mission and the regulatory environment? Option A. Develop a multifaceted strategy that includes exploring partnerships with community organizations to expand home-based care options, investing in telehealth capabilities to reach more patients, and advocating for policy changes to improve reimbursement for geriatric services, while simultaneously optimizing internal resource allocation to improve efficiency within the existing specialist team. Option B. Immediately reduce the number of available geriatric appointments and reallocate those resources to more profitable service lines to improve the organization's overall financial performance. Option C. Expand the geriatric service line by hiring additional specialists and acquiring new facilities, without a clear financial plan or consideration of current reimbursement limitations, assuming increased patient volume will naturally offset the costs. Option D. Continue to operate with the current supply of geriatric services, focusing solely on maximizing revenue from existing patients through increased copays and deductibles, without addressing the growing demand or the underlying cost structure. The correct answer is A. Develop a multifaceted strategy that includes exploring partnerships with community organizations to expand home-based care options, investing in telehealth capabilities to reach more patients, and advocating for policy changes to improve reimbursement for geriatric services, while simultaneously optimizing internal resource allocation to improve efficiency within the existing specialist team. Explanation: this scenario presents a classic challenge in healthcare management, balancing the financial sustainability of a healthcare organization with its ethical obligation to serve a community facing increasing demand for specific services. The tension arises from the finite resources available, supply, and the growing needs of the patient population, demand. Professionals must navigate this by considering not only operational efficiency, but also the regulatory landscape governing healthcare access, quality, and financial viability. The PAHM framework emphasizes ethical leadership and strategic management within the U.S. healthcare system. The correct approach involves a comprehensive analysis of both supply and demand, considering the regulatory environment that dictates how services can be offered and reimbursed. This includes understanding Medicare and Medicaid regulations, state licensing requirements, and any applicable federal or state mandates regarding access to care. A strategic decision that aligns with these regulations while addressing the underlying supply and demand imbalance is crucial. This might involve exploring partnerships, optimizing existing resources, or advocating for policy changes that support increased supply where needed, all within the bounds of legal and ethical practice. An incorrect approach would be to solely focus on increasing patient volume, without considering the capacity of the existing infrastructure or the financial implications of serving a larger, potentially underinsured population. This could lead to a decline in quality of care, staff burnout, and potential violations of regulations related to patient safety and access. Another incorrect approach is to restrict access to services based on profitability alone, disregarding the organization's community benefit obligations and the ethical imperative to provide care. This could result in regulatory scrutiny and damage to the organization's reputation. Furthermore, ignoring the demand for specific services and continuing with the current supply model, even if financially stable, fails to address the growing needs of the community and represents a missed opportunity for strategic growth and improved public health outcomes, potentially falling short of the spirit of community service expected of healthcare organizations. Professionals should employ a decision-making process that begins with data-driven assessment of supply and demand, followed by a thorough review of the relevant U.S. healthcare regulations. This includes evaluating the financial feasibility of various strategies, considering the ethical implications for patient access and quality, and engaging stakeholders, including community representatives and regulatory bodies, in the decision-making process. The ultimate goal is to develop a sustainable solution that maximizes patient benefit while ensuring organizational viability within the legal and ethical framework. Question 8. When evaluating potential cost-saving measures for a health maintenance organization, HMO, which approach best ensures compliance with regulatory requirements and ethical obligations to members? Option A. Conducting a comprehensive impact assessment that analyzes the effects of proposed cost-saving measures on provider network adequacy, enrollee access to medically necessary services, and the overall quality of care, alongside financial projections. Option B. Implementing changes that prioritize immediate financial savings by streamlining administrative processes and renegotiating provider contracts to reduce overall expenditure, with a secondary review of potential impacts on member access. Option C. Focusing on reducing the scope of covered benefits to exclude services that are less frequently utilized by the membership, thereby lowering the overall cost of claims. Option D. Increasing enrollee cost-sharing mechanisms, such as higher deductibles and co-payments, to shift a greater portion of healthcare expenses directly to members. The correct answer is B. implementing changes that prioritize immediate financial savings by streamlining administrative processes and renegotiating provider contracts to reduce overall expenditure, with a secondary review of potential impacts on member access. Explanation: this scenario presents a professional challenge because it requires a healthcare manager to balance the financial viability of a health maintenance organization, HMO, with its ethical and regulatory obligations to provide comprehensive care to its members. The pressure to reduce costs can lead to decisions that might inadvertently compromise patient access to necessary services, creating a conflict between business objectives and patient well-being. Careful judgment is required to ensure that cost containment measures do not violate the principles of patient advocacy and the specific mandates governing HMO operations. The correct approach involves a thorough assessment of the impact of proposed changes on patient access to care, provider networks, and overall quality of services, while simultaneously considering the financial implications. This approach is correct because it aligns with the fundamental regulatory framework for HMOs, which prioritizes member health and access to services. Specifically, regulations often require HMOs to maintain adequate and accessible provider networks, ensure timely access to care, and provide a defined set of covered benefits. A comprehensive impact assessment ensures that any proposed changes are evaluated against these core requirements, preventing potential violations of patient rights and regulatory compliance. Ethical considerations also dictate that the well-being of members should not be unduly sacrificed for financial gain. An incorrect approach that focuses solely on immediate cost reduction without considering the downstream effects on patient care is professionally unacceptable. This failure stems from a disregard for the regulatory obligations of HMOs to provide accessible and appropriate care. For instance, unilaterally reducing provider reimbursement rates without ensuring network adequacy could lead to provider attrition, thereby limiting member access to specialists or essential services, which would likely violate network adequacy provisions. Another incorrect approach might involve narrowly interpreting covered benefits to exclude services that are medically necessary but not explicitly detailed in the plan documents, potentially leading to denials of care that are not in accordance with federal and state laws governing medical necessity and enrollee protections. Such actions would represent a failure to uphold the fiduciary duty to members and a breach of regulatory compliance. Professionals should employ a decision-making framework that begins with identifying the core problem or proposed change. Next, they should consult the relevant regulatory statutes, guidelines, and contractual obligations pertaining to HMOs. This is followed by an analysis of the potential impacts of the proposed change on all stakeholders, with a particular emphasis on patient access, quality of care, and provider relationships. Finally, decisions should be made that demonstrably uphold regulatory compliance and ethical principles, even if they require more complex or less immediately profitable solutions. Question 9. System analysis indicates a patient has an outstanding balance following insurance adjudication. The patient has contacted the billing department expressing concern about their ability to pay the remaining amount. What is the most appropriate next step for the healthcare organization's revenue cycle management team? Option A. Conduct a thorough review of the patient's account, verify insurance details, and assess eligibility for the organization's financial assistance programs. Option B. Write off the outstanding balance as uncollectible to expedite account closure. Option C. Send a series of increasingly aggressive collection letters to the patient. Option D. Immediately initiate the process for referring the account to a third-party collection agency. The correct answer is D. Immediately initiate the process for referring the account to a third-party collection agency. Explanation: scenario analysis. This scenario is professionally challenging because it requires balancing the financial needs of a healthcare organization with the ethical and regulatory obligations to patients regarding their billing and financial assistance. Mismanagement of the revenue cycle can lead to patient dissatisfaction, potential legal repercussions, and damage to the organization's reputation. The PAHM professional must navigate complex payer contracts, federal and state regulations, and internal policies to ensure accurate billing, timely collections, and appropriate financial assistance for eligible patients. Correct approach analysis. The correct approach involves a systematic review of the patient's account, verification of insurance coverage, and adherence to the organization's established financial assistance policies. This aligns with the principles of patient-centered care and regulatory compliance, ensuring that patients receive clear and accurate billing information and are offered appropriate support if they are unable to meet their financial obligations. Specifically, this approach respects the patient's right to understand their financial responsibility and access available assistance, which is often mandated by regulations such as the Affordable Care Act, ACA, and state-specific consumer protection laws related to healthcare billing. It also upholds the organization's commitment to ethical financial practices. Incorrect approaches analysis, an approach that immediately refers the account to a third-party collection agency without first attempting internal resolution or assessing the patient's eligibility for financial assistance fails to meet regulatory and ethical standards. This can violate the Fair Debt Collection Practices Act, FDCPA, if the collection efforts are deemed aggressive or misleading, and it bypasses the organization's responsibility to offer financial aid as potentially required by the ACA's provisions for nonprofit hospitals regarding financial assistance policies. Another incorrect approach, which is to simply write off the balance as uncollectible without proper documentation or investigation, neglects the revenue cycle management process and may indicate a failure to comply with payer contract terms or internal financial controls. This can lead to revenue loss and potential audit findings if proper procedures for bad debt determination are not followed. Finally, an approach that involves aggressive and persistent billing without offering clear explanations or avenues for financial assistance can lead to patient distress and potential violations of consumer protection laws. It also undermines the trust between the patient and the healthcare provider, which is a core ethical consideration in healthcare management. Professional reasoning. Professionals in healthcare management must adopt a proactive and patient-centric approach to revenue cycle management. This involves understanding the regulatory landscape, including payer contracts, federal and state billing regulations, and financial assistance requirements. When faced with a patient's inability to pay, the first step should always be to investigate the situation thoroughly, verify insurance, and explore all available internal financial assistance options before resorting to external collection efforts or writing off the debt. This systematic process ensures both financial health for the organization and equitable treatment for patients. Question 10. The assessment process reveals that the healthcare organization is experiencing significant financial pressure, prompting a review of its service line economics to identify areas for cost reduction and efficiency improvement. Which of the following approaches best balances financial sustainability with the organization's commitment to patient care and regulatory compliance? Option A. Reduce staffing levels uniformly across all departments, irrespective of patient volume or acuity. Option B. Eliminate services with the highest direct operational costs, regardless of their impact on overall patient health or their role in care pathways. Option C. Implement across-the-board reductions in service line budgets without a detailed assessment of their impact on patient care quality. Option D. Conduct a thorough analysis of patient outcomes data in conjunction with cost data for each service line to identify opportunities for value enhancement. The correct answer is D. Conduct a thorough analysis of patient outcomes data in conjunction with cost data for each service line to identify opportunities for value enhancement. Explanation. Scenario analysis. This scenario presents a common implementation challenge in healthcare economics, balancing the need for cost-effectiveness with the ethical imperative to provide quality care. The organization is facing financial pressures, a reality in healthcare, which necessitates a review of service delivery models. The challenge lies in identifying and implementing changes that improve efficiency without compromising patient outcomes or violating regulatory mandates. This requires a nuanced understanding of healthcare economics principles, regulatory compliance, and ethical considerations. The professional challenge is to navigate these competing demands, ensuring that decisions are data-driven, legally sound, and ethically defensible. Correct approach analysis. The correct approach involves a comprehensive analysis of patient outcomes data alongside cost data for each service line. This approach is right because it directly addresses the core of healthcare economics, maximizing value, which is defined as the ratio of health outcomes to costs. By examining both metrics, the organization can identify services that are either high cost with suboptimal outcomes or low cost with excellent outcomes, and vice versa. This data-driven methodology allows for targeted interventions, such as process improvements, technology adoption, or care coordination enhancements, to improve efficiency and effectiveness. This aligns with the principles of value-based care, which is increasingly emphasized in U.S. healthcare policy and regulation, aiming to shift focus from volume to value. Specifically, regulatory frameworks like the Affordable Care Act, ACA, and initiatives from the Centers for Medicare and Medicaid Services, CMS, promote payment models that reward quality and efficiency, making this data-driven approach not only economically sound, but also compliant with evolving regulatory expectations. Incorrect approaches analysis. Implementing across-the-board service line cuts without a detailed analysis of their impact on patient outcomes is an incorrect approach. This is a blunt instrument that risks disproportionately affecting services critical to patient well-being, potentially leading to poorer health outcomes and increased downstream costs due to complications or delayed care. Ethically, it violates the principle of beneficence and non-maleficence. From a regulatory standpoint, such cuts could lead to non-compliance with quality metrics or access standards mandated by payers or government programs. Focusing solely on reducing staffing levels in all departments without considering the specific workload and patient acuity of each area is also an incorrect approach. This can lead to understaffing in critical areas, compromising patient safety and quality of care. It ignores the economic principle that labor costs are only one component of overall service cost, and that insufficient staffing can lead to increased errors, longer lengths of stay, and higher readmission rates, ultimately increasing costs. This approach also risks violating labor laws and professional standards of care, prioritizing the elimination of services with the highest direct operational costs, irrespective of their contribution to overall patient health or their role in a coordinated care pathway, is another incorrect approach. This overlooks the concept of total cost of care and the potential for certain high-cost services to prevent even more expensive interventions or complications later. For example, a specialized diagnostic service might appear costly, but could be essential for early detection and effective treatment, thus reducing long-term healthcare expenditures. This approach fails to consider the interconnectedness of healthcare services and the broader economic impact. Professional reasoning. Professionals should employ a systematic, data-driven approach to healthcare economic challenges. This involves 1. Defining the problem clearly, acknowledging both financial and clinical dimensions. 2. Gathering comprehensive data, including patient outcomes, cost data, and operational metrics. 3. Analyzing this data to identify areas of inefficiency or suboptimal value. 4. Developing targeted interventions based on this analysis, considering both cost-effectiveness and impact on patient care. 5. Evaluating proposed solutions against regulatory requirements and ethical principles. 6. Implementing changes with careful monitoring and continuous improvement. This structured process ensures that decisions are informed, defensible, and aligned with the organization's mission to provide high-quality, cost-effective care within the U.S. regulatory landscape. Question 11. Regulatory review indicates that a healthcare organization is considering several strategic initiatives to improve its competitive position and operational efficiency. Which approach to assessing the potential impact of these initiatives best aligns with the principles of responsible healthcare management and regulatory compliance within the U.S. healthcare system? Option A. Conducting a comprehensive impact assessment that quantifies potential effects on patient care quality, operational efficiency, financial sustainability, and regulatory compliance. Option B. Focusing exclusively on strategies that promise to increase market share without evaluating the organization's capacity to handle increased patient volume. Option C. Relying primarily on informal feedback from key stakeholders and anecdotal evidence to gauge the potential success of initiatives. Option D. Prioritizing initiatives based solely on their projected short-term cost reduction benefits. Correct answer is A. Conducting a comprehensive impact assessment that quantifies potential effects on patient care quality, operational efficiency, financial sustainability, and regulatory compliance. Explanation. This scenario presents a professional challenge because healthcare organizations are increasingly expected to demonstrate a proactive and data-driven approach to strategic planning, particularly in response to evolving regulatory landscapes and the imperative for quality improvement. The challenge lies in balancing the need for comprehensive analysis with the practical constraints of time and resources, while ensuring that the chosen strategic direction aligns with both organizational mission and regulatory compliance. Careful judgment is required to select an impact assessment approach that is both robust enough to inform meaningful strategic decisions and feasible to implement effectively. The correct approach involves conducting a thorough impact assessment that systematically evaluates the potential effects of proposed strategic initiatives on patient care quality, operational efficiency, financial sustainability, and regulatory compliance. This approach is right because it directly addresses the core responsibilities of healthcare management, which include ensuring high-quality patient outcomes and adherence to all applicable laws and guidelines. Specifically, within the U.S. regulatory framework governing healthcare organizations, such as those overseen by CMS and HHS, a strategic plan must demonstrably contribute to meeting quality metrics, patient safety standards, and financial viability, all of which are subject to regulatory scrutiny. An impact assessment that quantifies these potential effects provides the necessary evidence base for informed decision-making and for demonstrating due diligence to regulatory bodies. An incorrect approach that focuses solely on immediate cost savings without considering long-term quality implications would be professionally unacceptable. This failure stems from a disregard for the regulatory emphasis on patient outcomes and safety, which are paramount. Such an approach could lead to strategic decisions that, while appearing financially beneficial in the short term, ultimately compromise patient care and could result in regulatory penalties or reputational damage. Another incorrect approach that prioritizes market share growth above all else, without a commensurate assessment of the organization's capacity to deliver high-quality care under increased demand, would also be professionally flawed. This overlooks the regulatory requirement for healthcare providers to operate within their capacity and to maintain standards of care. A failure to assess operational readiness and quality implications could lead to patient dissatisfaction, adverse events, and noncompliance with service delivery regulations. A third incorrect approach that relies on anecdotal evidence and stakeholder opinions without rigorous data analysis would be professionally unsound. While stakeholder input is valuable, strategic decisions must be grounded in objective data to ensure they are evidence-based and defensible. Regulatory bodies expect organizations to use data to inform their strategies and to measure their progress. Relying solely on qualitative information risks making decisions that are not aligned with the organization's true needs or the regulatory environment. The professional decision-making process for similar situations should involve a structured framework that begins with clearly defining the strategic objectives. This should be followed by identifying potential strategic initiatives. For each initiative, a comprehensive impact assessment should be conducted, considering all relevant dimensions: clinical quality, patient safety, operational capacity, financial implications, and regulatory compliance. This assessment should utilize both quantitative and qualitative data. The findings should then be used to prioritize initiatives, develop implementation plans, and establish metrics for ongoing monitoring and evaluation. This systematic, data-driven, and compliance-aware approach ensures that strategic decisions are sound, ethical, and aligned with the organization's mission and regulatory obligations. Question 12. The efficiency study reveals significant opportunities to reduce costs by streamlining diagnostic testing pathways and adjusting referral patterns for specific chronic conditions. The ACO leadership is eager to implement these changes to improve financial performance and meet performance benchmarks. What is the most appropriate next step for the ACO leadership to ensure these changes are implemented responsibly and ethically? Option A. Focus solely on the financial projections of the efficiency study and instruct the finance department to develop an implementation plan to realize these cost savings. Option B. Forward the efficiency study to the ACO's quality and compliance committees for a thorough review of its findings, potential impact on patient care, and alignment with regulatory requirements before any implementation. Option C. Immediately direct frontline clinicians to adopt the proposed changes based on the study's financial projections and efficiency gains. Option D. Share the efficiency study's findings directly with frontline clinicians, encouraging them to voluntarily adjust their practices to align with the proposed cost-saving measures. Correct answer is C. Immediately direct frontline clinicians to adopt the proposed changes based on the study's financial projections and efficiency gains. Explanation. Scenario analysis. This scenario presents a common challenge in accountable care organizations (ACO), where financial incentives for improved quality and cost reduction can create tension with established provider practices and patient care priorities. The professional challenge lies in balancing the ACO's financial sustainability and performance metrics with the ethical imperative to provide high-quality, patient-centered care, especially when faced with potential conflicts of interest or pressure to prioritize certain interventions over others. Careful judgment is required to ensure that any proposed changes align with both regulatory requirements and the core mission of patient well-being. Correct approach analysis. The correct approach involves a thorough review of the efficiency study's findings by the ACO's quality and compliance committees. This committee structure is designed to provide a multidisciplinary perspective, ensuring that proposed changes are evaluated not only for their financial impact, but also for their potential effects on patient outcomes, care coordination, and adherence to regulatory standards. Specifically, the committee would assess whether the study's recommendations for streamlining care pathways or prioritizing certain diagnostic tests are evidence-based, align with established clinical guidelines, and do not inadvertently create barriers to necessary care for specific patient populations. This approach is justified by the Centers for Medicare and Medicaid Services (CMS) regulations governing ACOs, which emphasize the importance of quality improvement and patient outcomes. Furthermore, ethical principles of beneficence and non-maleficence necessitate that any changes to care delivery are demonstrably beneficial or at least not harmful to patients. Incorrect approaches analysis. Implementing the efficiency study's recommendations without independent review by the quality and compliance committees is an incorrect approach. This bypasses essential oversight mechanisms designed to safeguard patient care and ensure regulatory compliance. Such an approach risks prioritizing cost savings over patient well-being, potentially leading to underutilization of necessary services or the adoption of unproven cost-saving measures. This could violate CMS requirements for quality reporting and performance improvement, and potentially lead to sanctions or exclusion from the ACO program. Focusing solely on the financial projections of the efficiency study and directing immediate implementation based on those projections is also an incorrect approach. This demonstrates a failure to consider the broader implications for patient care and quality. It prioritizes financial gain over the core mission of an ACO, which is to deliver high-quality, coordinated care. This narrow focus can lead to unintended consequences, such as decreased patient satisfaction, adverse health outcomes, and potential regulatory noncompliance if quality metrics are negatively impacted. Directly communicating the efficiency study's findings to frontline clinicians and encouraging them to adopt the proposed changes without a formal review process is another incorrect approach. While clinician buy-in is important, this method bypasses the structured evaluation necessary to ensure that the proposed changes are clinically sound, evidence-based, and compliant with ACO regulations. It places undue pressure on clinicians to alter their practice based on potentially incomplete or biased information, risking patient safety and undermining the integrity of the ACO's quality improvement efforts. Professional reasoning. Professionals in ACOs must adopt a systematic and evidence-based decision-making process. This involves 1. Acknowledging and critically evaluating all data, including efficiency studies, for potential biases and limitations. 2. Engaging relevant internal committees, quality, compliance, clinical leadership, for comprehensive review and risk assessment. 3. Ensuring proposed changes are aligned with regulatory requirements, e.g., CMS ACO program rules and ethical principles. 4. Prioritizing patient outcomes and quality of care in all decisions, even when financial considerations are significant. 5. Implementing changes through a phased approach with ongoing monitoring and evaluation to ensure effectiveness and patient safety. Question 13. The audit findings indicate a discrepancy between the preferred provider organizations, PPO, reported network adequacy, and the actual availability of contracted providers for its enrollees. Which of the following approaches best addresses this situation to ensure regulatory compliance and member access to care? Option A. Update the PPO's provider directory with current contact information for all listed providers, assuming active participation unless otherwise indicated by member complaints. Option B. Rely primarily on member grievances and anecdotal feedback to identify potential network access issues and address them on a case-by-case basis. Option C. Immediately terminate contracts with providers who have low utilization rates to streamline the network and reduce administrative overhead without a prior assessment of network impact. Option D. Conduct a comprehensive review of all provider contracts to verify active participation and assess geographic and specialty coverage against established network adequacy standards, implementing targeted recruitment or corrective actions as needed. The correct answer is D. Conduct a comprehensive review of all provider contracts to verify active participation and assess geographic and specialty coverage against established network adequacy standards, implementing targeted recruitment or corrective actions as needed. Explanation: this scenario is professionally challenging because it requires balancing the operational efficiency of a preferred provider organization, PPO, with its contractual obligations and the regulatory landscape governing healthcare networks. The audit findings highlight a potential disconnect between the PPO's stated network adequacy and its actual provider availability, which can lead to patient access issues and potential noncompliance with federal and state regulations. Careful judgment is required to ensure that the PPO's network management practices align with its commitments to enrollees and the oversight bodies. The correct approach involves a proactive and data-driven review of provider contracts and network performance metrics to identify and rectify any gaps in network adequacy. This includes verifying that contracted providers are actively participating in the network and that the geographic distribution and specialty coverage meet established standards. This approach is best professional practice because it directly addresses the audit findings by ensuring the PPO upholds its commitment to providing timely and adequate access to care for its members, which is a fundamental requirement under regulations such as the Affordable Care Act, ACA, and state-specific network adequacy laws. By systematically reviewing contracts and performance, the PPO can demonstrate due diligence and compliance. An incorrect approach that focuses solely on updating provider directories without verifying actual network participation fails to address the root cause of the audit findings. This approach is ethically and regulatorily flawed because it creates a misleading representation of network availability, potentially violating consumer protection laws and ACA requirements for accurate provider information. Another incorrect approach that involves terminating contracts with underutilized providers without assessing the impact on network adequacy is also professionally unacceptable. This can lead to network deficiencies, particularly in underserved areas or for specific specialties, thereby violating network adequacy standards and potentially leading to enrollee harm and regulatory penalties. A third incorrect approach that relies on anecdotal evidence from member complaints to assess network adequacy is insufficient. While member feedback is valuable, it is not a substitute for systematic data analysis and contractual verification. Relying solely on complaints bypasses the proactive measures needed to ensure ongoing compliance and can result in delayed identification of systemic network issues. The professional decision-making process for similar situations should involve a multifaceted approach. 1. Acknowledge and thoroughly investigate audit findings. 2. Review relevant contractual obligations with providers. 3. Analyze network performance data against regulatory standards for adequacy. 4. Implement corrective actions that are both compliant and sustainable. 5. Maintain transparent communication with regulatory bodies and stakeholders regarding findings and remediation plans. Question 14. The efficiency study reveals significant bottlenecks in patient discharge processes, leading to extended bed occupancy and increased operational costs. Which of the following approaches to addressing these findings is most aligned with professional healthcare management principles and regulatory expectations for patient safety and quality of care? Option A. Implement immediate process changes based on the study's recommendation, prioritizing cost savings and operational streamlining, with a post-implementation review of any patient safety incidents. Option B. Rely on the experience of long-serving department heads to identify and implement the most obvious solutions to the identified bottlenecks, assuming their judgment will safeguard patient interests. Option C. Defer any significant changes until a clear and quantifiable negative patient outcome directly attributable to the discharge process bottlenecks is documented. Option D. Conduct a thorough, data-driven risk assessment of all proposed process changes, evaluating potential impacts on patient safety, quality of care, and regulatory compliance before implementation. The correct answer is A. Implement immediate process changes based on the study's recommendations, prioritizing cost savings and operational streamlining, with a post-implementation review of any patient safety incidents. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a healthcare manager to interpret findings from an efficiency study and determine the most appropriate risk assessment approach. The challenge lies in balancing the need for operational improvement with the imperative to maintain patient safety and comply with regulatory standards. A hasty or misinformed decision could lead to suboptimal resource allocation, increased patient risk, or regulatory noncompliance, all of which have significant financial and ethical implications for the organization. Careful judgment is required to select an approach that is both effective in addressing inefficiencies and robust in its risk management framework. Correct approach analysis. The correct approach involves a comprehensive, data-driven risk assessment that prioritizes patient safety and regulatory adherence. This method is correct because it directly addresses the identified inefficiencies by systematically evaluating potential risks associated with proposed changes. It aligns with the core principles of healthcare management, which mandate a proactive approach to risk mitigation. Specifically, within the U.S. regulatory framework governing healthcare organizations, such as those overseen by CMS and accrediting bodies, a thorough risk assessment is a foundational element for implementing any significant operational change. This approach ensures that potential adverse events are identified, analyzed, and controlled before they impact patient care or organizational compliance. It demonstrates due diligence and a commitment to quality improvement that is both ethically sound and legally defensible. Incorrect approach is analysis. An approach that focuses solely on cost reduction without a commensurate risk assessment fails to acknowledge the paramount importance of patient safety and regulatory compliance. This is ethically unacceptable as it prioritizes financial gain over patient well-being. From a regulatory standpoint, such an approach could violate conditions of participation for programs like Medicare and Medicaid, which require organizations to maintain safe environments and quality care. An approach that relies on anecdotal evidence or the opinions of a few senior staff members, rather than a systematic, data-driven analysis, is also professionally unsound. This method is prone to bias and may overlook critical risks that are not immediately apparent. It lacks the rigor required by healthcare regulations and professional standards for decision-making, particularly when significant operational changes are contemplated. An approach that delays any action until a specific adverse event occurs is reactive and fundamentally flawed. Healthcare management principles and regulations emphasize a proactive stance on risk management. Waiting for an incident to happen is not only ethically irresponsible, but also likely to result in significant patient harm, regulatory penalties, and reputational damage. This approach demonstrates a failure to implement a robust quality improvement and patient safety program. Professional reasoning. Healthcare professionals must adopt a systematic decision-making process when faced with efficiency study findings. This process should begin with a thorough understanding of the study's implications for patient care and operational integrity. The next step involves identifying potential risks associated with proposed changes, followed by a comprehensive risk assessment that quantifies the likelihood and impact of these risks. Based on this assessment, mitigation strategies should be developed and implemented, with ongoing monitoring and evaluation to ensure effectiveness. This framework ensures that decisions are informed, evidence-based, and aligned with regulatory requirements and ethical obligations to patient safety. Question 15. Research into optimizing healthcare reimbursement methodologies for a U.S.-based healthcare organization has identified several potential strategies, considering the need for process improvement while strictly adhering to U.S. healthcare regulations and PAHM guidelines. Which of the following approaches represents the most effective and compliant path forward? Option A. Implementing a rigorous process of auditing clinical documentation to ensure it fully supports all billed services and codes, alongside refining claim submission workflows for accuracy and timeliness. Option B. Focusing on expanding the range of billable services offered by the organization without a commensurate increase in patient volume or documented medical necessity. Option C. Streamlining the claims processing system to expedite submission, even if it means reducing the depth of documentation review for each claim. Option D. Aggressively pursuing increased reimbursement rates from all payers through contract renegotiations, regardless of the underlying complexity of the reimbursement methodologies. The correct answer is A. Implementing a rigorous process of auditing clinical documentation to ensure it fully supports all billed services and codes, alongside refining claims submission workflows for accuracy and timeliness. Explanation. This scenario presents a professional challenge in optimizing healthcare reimbursement methodologies within the U.S. regulatory framework, specifically for organizations operating under the Professional Academy for Healthcare Management (PAHM) guidelines. The core difficulty lies in balancing the drive for increased revenue with the imperative to adhere to complex and evolving reimbursement rules, ensuring ethical practices and patient care quality are not compromised. Careful judgment is required to select an approach that is both financially sound and compliant. The correct approach involves a comprehensive review and strategic adjustment of existing reimbursement processes to align with current payer policies and coding guidelines, focusing on accurate documentation and efficient claim submission. This is justified by the U.S. regulatory framework, which emphasizes accurate reporting and compliance to prevent fraud, waste, and abuse. Adherence to guidelines from bodies like the Centers for Medicare and Medicaid Services, CMS, and private payers is paramount. Optimizing processes for accurate coding and timely submission directly supports compliant revenue cycle management, ensuring that services rendered are appropriately reimbursed without violating regulations. An incorrect approach that focuses solely on increasing billing codes without a corresponding increase in documented services or patient encounters is ethically and regulatorily unsound. This could lead to allegations of upcoding or fraudulent billing, violating the False Claims Act and other anti-fraud statutes. Another incorrect approach that prioritizes rapid claim submission over thorough documentation review risks submitting incomplete or inaccurate claims, which can result in denials, delayed payments, and potential audits. This failure to ensure accuracy and completeness violates payer requirements and can lead to financial penalties. A third incorrect approach that involves negotiating payer contracts without a thorough understanding of the underlying reimbursement methodologies and their impact on operational workflows can lead to unfavorable terms that are unsustainable or difficult to implement, potentially impacting the organization's financial health and ability to provide care. Professional decision-making in similar situations requires a systematic approach. First, thoroughly understand the current reimbursement landscape and organizational performance metrics. Second, identify specific areas for improvement within the revenue cycle, prioritizing those with the greatest potential for compliant optimization. Third, engage relevant stakeholders, including clinical staff, coding specialists, and billing departments, to ensure buy-in and accurate implementation. Finally, continuously monitor performance and adapt strategies in response to changes in regulations and payer policies, always maintaining a commitment to ethical practice and patient well-being. Question 16. To address the challenge of a patient arriving at the emergency department in visible distress and unable to immediately provide all required identification and insurance documentation, what is the most appropriate course of action for the registration staff? Option A. Proceed with registration and medical assessment without any attempt to document the patient's identity or insurance information, assuming it will be resolved later. Option B. Make an assumption about the patient's insurance coverage based on their appearance and proceed with registration and medical assessment. Option C. Refuse to begin the registration process or medical assessment until the patient provides all standard identification and insurance verification. Option D. Initiate immediate medical assessment and treatment, while concurrently working with the patient to obtain necessary documentation through alternative means or provisional registration. The correct answer is D. Initiate immediate medical assessment and treatment, while concurrently working with the patient to obtain necessary documentation through alternative means or provisional registration. Explanation. This scenario presents a professional challenge because it pits the ethical imperative of providing timely and equitable access to healthcare against the operational realities of a healthcare organization and the need to adhere to established registration protocols. The registrar is faced with a patient in distress who lacks the required documentation for immediate registration, creating a conflict between compassion and policy. Careful judgment is required to balance these competing demands without compromising patient well-being or organizational integrity. The correct approach involves prioritizing immediate patient care while initiating the registration process and addressing documentation requirements concurrently. This aligns with the ethical principle of beneficence, which obligates healthcare professionals to act in the best interest of the patient. Furthermore, it reflects the spirit of regulations that aim to ensure access to care, particularly in emergent situations, by allowing for provisional registration or alternative verification methods when standard documentation is unavailable. This approach acknowledges the patient's immediate need for medical attention, which is paramount, while still working towards fulfilling administrative requirements in a sensitive and timely manner. An incorrect approach that strictly adheres to documentation requirements before any medical assessment or intervention would fail to uphold the ethical duty to provide care to those in need, potentially delaying critical treatment and exacerbating the patient's condition. This could also violate regulatory guidelines that emphasize access to emergency services. Another incorrect approach, which involves bypassing all registration protocols and providing care without any attempt to document the patient's identity or insurance information, could lead to significant administrative and financial challenges for the organization, potentially impacting future billing and record-keeping accuracy, and may not fully comply with all reporting requirements. A third incorrect approach, which involves making assumptions about the patient's ability to pay or their insurance status without proper verification, could lead to financial losses for the provider and potential issues for the patient if their coverage is not as assumed. Professionals should employ a decision-making framework that begins with assessing the urgency of the patient's medical need. If the need is emergent, the priority shifts to stabilizing the patient and initiating care. Simultaneously, the registrar should explore all available options for provisional registration or alternative identification methods, communicating clearly with the patient about the process and the need for documentation. This involves a balance of empathy, adherence to ethical principles, and a thorough understanding of organizational policies and relevant regulations regarding patient access and registration, especially in urgent situations. Question 17. Analysis of a situation where a healthcare manager is reviewing claims for ambulatory surgical procedures and notices that a particular procedure, while documented, was performed with a less complex approach than typically associated with its assigned ambulatory payment classification (APC). The manager is concerned that the assigned APC may not accurately reflect the services rendered, potentially leading to overpayment. What is the most appropriate course of action to ensure regulatory compliance and ethical billing practices? Option A. Maintain the current APC assignment to avoid potential audit scrutiny and the administrative burden of claim resubmission, assuming the difference in reimbursement is minor. Option B. Reassign the APC to the most clinically appropriate group based on the documented services and consult official APC guidelines to confirm the correct assignment, even if it results in a lower reimbursement. Option C. Request the physician to amend the operative report to better justify the original APC assignment, even if it does not fully align with the actual services performed. Option D. Assign the lowest possible APC for all similar procedures to proactively mitigate any risk of overpayment and potential compliance issues. The correct answer is B. Reassign the APC to the most clinically appropriate group based on the documented services and consult official APC guidelines to confirm the correct assignment, even if it results in a lower reimbursement. Explanation. This scenario presents a professional challenge because it requires balancing accurate billing practices with the potential for financial repercussions and the ethical obligation to represent services truthfully. The healthcare manager must navigate the complexities of ambulatory payment classifications (APC) to ensure appropriate reimbursement while upholding compliance standards. The core of the challenge lies in the interpretation of APC guidelines and the potential for misclassification, which can lead to either under- or over-reimbursement, both of which have significant ethical and regulatory implications. The correct approach involves a thorough review of the patient's medical record and the services provided, comparing them against the official APC guidelines and coding conventions. This ensures that the most appropriate APC is assigned based on the clinical documentation and the established payment rules. This approach is ethically sound and regulatorily compliant because it adheres to the principle of accurate representation of services rendered. Specifically, it aligns with the Centers for Medicare and Medicaid Services (CMS) guidelines for APC assignment, which mandate that payment is based on the clinical services provided and their associated APC group. Misrepresenting services to achieve a higher APC payment constitutes fraud and abuse. An incorrect approach would be to assign an APC based on a desired reimbursement level rather than the documented services. This is ethically problematic as it involves intentional misrepresentation for financial gain. Regulatorily, it violates CMS requirements for accurate coding and billing, potentially leading to penalties, recoupments, and reputational damage. Another incorrect approach would be to consistently assign the lowest possible APC for all services to minimize audit risk, even when documentation supports a higher classification. While seemingly risk-averse, this approach can lead to under-reimbursement, which, while not fraudulent, can negatively impact the organization's financial viability and may not accurately reflect the value of services provided. It also fails to uphold the professional responsibility to seek appropriate reimbursement for services rendered. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review all available clinical documentation. 2. Consult official APC guidelines and coding resources. 3. Seek clarification from coding experts or compliance officers when ambiguity exists. 4. Document the rationale for APC assignment, especially in complex cases. 5. Implement regular audits and training to ensure ongoing compliance and accuracy. Question 18. The investigation demonstrates that a healthcare organization's quality improvement department wishes to analyze patient demographic and treatment data from the past 5 years to identify trends in readmission rates for a specific chronic condition. The department head has requested direct access to all electronic health records, (EHR), containing this information, stating that we need the full picture to understand the problem thoroughly. The organization's administrator is concerned about potential HIPAA violations under the HITECH Act. What is the most appropriate course of action for the administrator to ensure compliance with the HITECH Act while facilitating the Quality Improvement Initiative? Option A. Limit the Quality Improvement Department's access to only aggregated, pre-existing reports on readmission rates, even if this limits the depth of their analysis. Option B. Consult with the organization's privacy officer and legal counsel to determine if the data can be de-identified according to HITECH Act standards, or if patient authorization is required before granting access to any EHR data. Option C. Authorize the Quality Improvement Department to access all requested EHRs, with a directive to only focus on the specific condition and to avoid sharing identifiable information externally. Option D. Proceed with the analysis using the full EHR data, as internal quality improvement activities are generally exempt from strict HIPAA privacy rules under the HITECH Act. The correct answer is C. Authorize the Quality Improvement Department to access all requested EHRs, with a directive to only focus on the specific condition and to avoid sharing identifiable information externally. Explanation. The investigation demonstrates a common ethical and regulatory challenge faced by healthcare organizations under the HITECH Act, balancing the need for data analysis to improve patient care with the stringent requirements for protecting protected health information. 5. The scenario is professionally challenging because it involves a direct conflict between a perceived operational benefit and a fundamental legal obligation. The healthcare administrator must navigate the complexities of HIPAA privacy rule, as augmented by HITECH, which mandates specific safeguards for PHI, even when used for internal quality improvement initiatives. The administrator's judgment is critical in ensuring that any data use adheres to the minimum necessary standard, and that appropriate de-identification or authorization processes are followed. The correct approach involves meticulously reviewing the proposed data analysis project against the HITECH Act's provisions, specifically focusing on the HIPAA privacy rules requirements for the use and disclosure of PHI. This includes determining if the data can be de-identified according to the safe harbor or expert determination methods, or if patient authorization is required. If the data is to be used for research or quality improvement, the organization must ensure it complies with the minimum necessary standard, meaning only the minimum amount of PHI required for the stated purpose is accessed or disclosed. This approach prioritizes patient privacy and regulatory compliance, thereby mitigating legal and reputational risks. An incorrect approach would be to proceed with the data analysis without a thorough regulatory review, assuming that internal use for quality improvement automatically exempts the organization from strict HIPAA compliance. This fails to recognize that the HITECH Act strengthened HIPAA privacy and security protections, making it clear that even for internal purposes, the use of PHI must be governed by specific rules. Another incorrect approach would be to proceed with the analysis using identifiable PHI without obtaining proper patient authorization or without a valid business associate agreement if a third party is involved in the analysis. This directly violates the HIPAA privacy rules requirements for disclosure of PHI. A third incorrect approach would be to attempt to de-identify the data superficially without adhering to the specific standards outlined in the HITECH Act, thereby creating a false sense of compliance while still risking a breach of privacy. Professionals should employ a decision-making framework that begins with identifying the regulatory landscape, HITECH Act and HIPAA privacy rule. Next, they should assess the proposed action against these regulations, considering the nature of the data, the purpose of its use, and the potential for re-identification. This involves consulting with legal counsel and privacy officers. If the proposed action involves PHI, the administrator must determine the appropriate pathway for compliance, de-identification, patient authorization, or a waiver of authorization under specific research circumstances. The principle of minimum necessary should guide every step. Question 19. During the evaluation of a new electronic health record (EHR) system designed to enhance care coordination across multiple healthcare facilities, the IT and compliance teams identified that the system's core functionality requires access to a broad range of patient demographic and clinical data. The goal is to enable seamless information sharing among authorized providers to improve patient outcomes. However, concerns have been raised about the potential for unauthorized access and the scope of data sharing exceeding the minimum necessary for direct patient care. What is the most appropriate approach to ensure compliance with U.S. healthcare regulations while enabling the system's intended benefits? Option A. Grant all authorized healthcare providers full access to all patient data within the EHR system to ensure comprehensive information is available for care coordination, assuming the benefits of immediate access outweigh potential privacy risks. Option B. Implement the EHR system with robust de-identification and aggregation techniques for data used in cross-facility reporting and analytics, coupled with strict role-based access controls for direct patient care functions, ensuring only the minimum necessary PHI is accessible to each user. Option C. Prioritize the rapid deployment of the EHR system to realize its care coordination benefits, implementing only basic security measures initially and addressing advanced privacy safeguards in a later phase. Option D. Postpone the implementation of the new EHR system until a perfect solution for complete data anonymization across all functionalities can be developed to avoid any potential privacy concerns. The correct answer is B. Implement the EHR system with robust de-identification and aggregation techniques for data used in cross-facility reporting and analytics, coupled with strict role-based access controls for direct patient care functions, ensuring only the minimum necessary PHI is accessible to each user. Explanation. This scenario presents a common challenge in healthcare management, balancing the benefits of advanced health information technology, HIT, with the imperative to protect patient privacy and comply with regulations. The professional challenge lies in discerning the appropriate level of data access and sharing for a new HIT system designed to improve care coordination, while strictly adhering to the Health Insurance Portability and Accountability Act, HIPAA, in the United States. Careful judgment is required to ensure that the system's functionality does not inadvertently lead to privacy breaches or non-compliance. The correct approach involves a thorough risk assessment and the implementation of robust safeguards, including de-identification and aggregation of data where possible, and strict access controls. This aligns with HIPAA privacy rule, which permits the use and disclosure of protected health information, FI, for healthcare operations, but mandates that such uses be limited to the minimum necessary to achieve the intended purpose. The identification and aggregation reduce the risk of unauthorized access to individual patient data, thereby upholding patient privacy and regulatory compliance. An incorrect approach would be to grant broad access to all patient data within the new HIT system without sufficient controls. This fails to meet the minimum necessary standard of HIPAA, as it exposes PHI beyond what is required for care coordination and potentially increases the risk of breaches. Another incorrect approach would be to delay the implementation of the HIT system indefinitely due to privacy concerns without exploring mitigation strategies. This hinders the potential for improved patient care and operational efficiency, which is contrary to the goals of HIT adoption and could be seen as a failure to adequately manage organizational risks and opportunities. Finally, an approach that prioritizes system functionality over privacy protections, such as implementing the system with minimal security measures, directly violates HIPAA security rule, which requires covered entities to implement administrative, physical, and technical safeguards to protect the confidentiality, integrity, and availability of electronic PHI. Professionals should employ a decision-making framework that begins with understanding the regulatory landscape, HIPAA in this case. This should be followed by a comprehensive assessment of the proposed HIT system's functionalities and potential risks to patient privacy. Mitigation strategies, such as data anonymization, access controls, and audit trails, should be identified and implemented. The decision should then be made based on a balance between achieving the system's intended benefits and ensuring robust privacy and security protection, always prioritizing compliance with legal and ethical obligations. Question 20. Strategic planning requires a healthcare organization's administrator to evaluate a proposal from an external marketing firm seeking to use patient demographic and treatment history data to identify potential candidates for a new wellness program. The administrator must decide whether to share this protected health information. To facilitate targeted outreach. Which of the following approaches best aligns with the HIPAA privacy rule and ethical patient care principles? Option A. Share de-identified patient data with the marketing firm, as this eliminates privacy concerns. Option B. Obtain explicit written authorization from each patient whose PHI will be shared, detailing the specific information to be disclosed, the purpose of the disclosure, and the recipient. Option C. Proceed with sharing the PHI, classifying the marketing outreach as a healthcare operations activity to avoid the need for individual patient authorization. Option D. Share the PHI based on the general consent form signed by patients at the time of admission, assuming it covers all future communications. The correct answer is B. Obtain explicit written authorization from each patient whose PHI will be shared, detailing the specific information to be disclosed, the purpose of the disclosure, and the recipient. Explanation. This scenario is professionally challenging because it requires balancing the immediate operational needs of a healthcare organization with the stringent requirements of patient privacy under the Health Insurance Portability and Accountability Act, HIPAA, privacy rule. The administrator must make a decision that upholds legal obligations while also considering the practical implications for patient care and staff workflow. Careful judgment is required to ensure that any information sharing, even for seemingly beneficial purposes, strictly adheres to HIPAA minimum necessary standard and patient authorization requirements. The correct approach involves obtaining explicit written authorization from each patient before sharing their protected health information, with the external marketing firm. This directly aligns with the HIPAA privacy rule, which mandates that covered entities obtain patient authorization for uses and disclosures of PHI not otherwise permitted by the rule, such as for marketing purposes. The authorization must be specific, clearly stating what information will be disclosed, to whom, for what purpose, and the expiration date. This approach prioritizes patient autonomy and legal compliance, ensuring that the organization avoids potential violations and maintains patient trust. An incorrect approach would be to proceed with sharing the PHI without obtaining individual patient authorizations, relying on a general consent form signed at admission. General consents typically do not meet the specificity requirements for marketing disclosures under HIPAA. Another incorrect approach would be to share de-identified data, as the marketing firm's stated purpose of targeted outreach implies the need for identifiable patient information, making de-identification unsuitable for their needs and thus not a valid solution to the authorization requirement. Finally, assuming that the marketing is for healthcare operations and therefore permissible without authorization is a misinterpretation of HIPAA definitions. Marketing activities, as described, generally fall outside the scope of healthcare operations unless specific conditions are met, which are not indicated here. Professionals should employ a decision-making framework that begins with identifying the core legal and ethical obligations. In this case, the primary obligation is compliance with the HIPAA privacy rule. Next, they should assess the proposed action against these obligations, considering all relevant provisions. If the proposed action appears to conflict with regulations, the next step is to explore compliant alternatives. This involves understanding the nuances of the regulations, such as the definition of marketing and the requirements for patient authorization. Finally, the decision should be documented, including the rationale for the chosen course of action and any consultations with legal counsel or privacy officers.